Years after Nigeria reduced the prevalence of yellow fever, the disease has ferociously returned and is spreading across the country. This follows laboratory confirmation by the Nigeria Center for Disease Control of what was initially tagged as a mysterious death from strange disease. According to the Director General of the NCDC, Dr. Chikwe Ihekweazu, a total of 222 suspected cases, 19 confirmed cases, and 76 deaths have been reported in Bauchi, Delta, and Enugu. Most of the deaths occurred before laboratory samples were collected for testing last week. Experts say, if not checked, the fever may spread across the 36 states of the country, as Nigeria has a huge population of unvaccinated and unprotected people against the disease. Well, joining us to discuss this is the Managing Director, Trinity Healthcare Foundation, Dr. Nsiabasi Ekanem. Thank you very much for joining us.
Good. Thank you for having me.
How is it that this disease that can be cured through a vaccine is now causing death right now in 3 states?
Well, the truth is, like you've said, it's a vaccine-preventable disease, and the main mode of transmission of the virus is through mosquito bites. And unfortunately, as you've known, within the last 9 months or so, due to the COVID-19 pandemic, healthcare workers across the country have had their hands full, with trying to fight the pandemic. So unfortunately, that has left other aspects of the healthcare system, to suffer, like immunization. For Delta and even for Enugu, I know very well that there was already a plan by the National Primary Healthcare Development Agency to roll out massive vaccination. I mean, after a tip-off from the World Health Organization. But this was supposed to be done since June. Unfortunately, it couldn't hold, of course, because of the pandemic. And it's only unfortunate that it was after we recorded deaths that we now did a reactive vaccination.
In the midst of the pandemic as well?
Yes, in the midst of the pandemic. So right now, what we are looking forward to is more like a reactive immunization program rather than a proactive one. So it's quite unfortunate, but for diseases like this, there is often what we call routine immunization. In fact, that is basically what is done. So, for example, yellow fever is given to every child from 9 months and above, and of course to the age of 44. But because of the pandemic, for the last 9 months, such has not been done. And of course, in such situation, you expect outbreaks like this.
How do we blame this on the pandemic when we ought to have planned as a nation to do all of these things, even despite the pandemic?
Well, it's not just Nigeria alone. In fact, I will tell you that a report that came up from the Advisory Committee on Immunization Practice in the U.S., I was going through their report last week, showed that across the world, immunization services have seriously dropped, because it's not just about the supply end of it, where you deploy, healthcare workers to the community to provide the services. We also talk about the demand end. Are people coming to the healthcare centers in the midst of the pandemic when people are scared of going to the hospital and healthcare facilities? So it's both from the demand side, which is from the individuals, and from the supply side, which is from the healthcare workers. So,
well, in developed countries where this pandemic has held sway, a lot of these countries have Nigeria or Africa has tried in curtailing the spread of COVID-19. A lot of people say it's largely because of our youthful population, but other countries do not have that such luxury. So we've not had, our lockdown wasn't too long.
Okay.
So doesn't it mean that people would have at least gone to the hospital to do, if this was an important part of health?
Well, like you said, I said that there are 2 ways about it, the demand side and the supply side, all right? Now, from the demand side, we have already created so much fear in the minds of the people that, look, the hospital is like a hotspot for COVID-19. So people are scared of going to the hospital. That cannot be taken away. Now, again, on the other hand, we have healthcare workers whose hands are full. They are working day and night trying to ensure that they tackle the pandemic that is currently a scourge in Nigeria. So if you look at it, objectively, you see that it does not provide an opportunity for both the healthcare workers and individuals to meet together to have the vaccine.
So do we call a state of emergency on this yellow fever outbreak?
Honestly, it's already a state of emergency because 3 states are already down. The reports we had last week showed that there's already about over 50 cases that have been reported somewhere in Enugu, but we do not know whether those cases are linked to yellow fever. But if they are, that means places like Kogi, Adamawa, and some other states will also join. And that means that if we do not roll out massive reactive vaccination on time, then other states, in fact, the entire 36 states might be affected pretty soon.
Okay, so in all of this now, like you've posited, now the entire 36 states might be involved in all of this soon. What is the role of state government at this point?
I think at this point, the state government have to work with the National Primary Healthcare Development Agency.
What are the states of our PHCs?
Well, I would say that, the COVID-19 pandemic actually revealed a lot of things. The moribund situation of our primary healthcare centers. And that is where we keep emphasizing health system strengthening. We need to really work in our primary healthcare center. These are the first port of call for most people at the community level. So we need to make sure that we strengthen this place, ensure that we have capable hands that can be able to, help in disease prevention, surveillance, and of course control. Now, state governments have to come in here to make sure that funding is appropriate funding is allocated to healthcare. From the national level down to the state level, this has to be put in place. Even to the local government level, healthcare must be prioritized so that we can help prevent disease and help to protect, the lives of people at the community.
If healthcare is prioritized, now how affordable will it be for the people? Because I've heard a lot of people say healthcare, not just in Nigeria, the world over, is largely expensive.
Well, if you look at everywhere in the world where, universal health coverage, which is what we are actually promoting right now, universal health coverage means leave no one behind, ensure that people can be able to afford healthcare without going through economic hardship. Now, for us to be able to achieve that, one thing is key. Number one, funding. Number two, insurance. All Nigerians must be covered in national health insurance, which is what is not happening now. Now, there was a repeal of the NHIS bill of 2005. Now, and then the Senate had already started processing the new bill, which is the mandatory health bill. Unfortunately, for the past few months, I've not heard anything about that. Now, we need to look again into that. All Nigerians must be covered so that we will not leave people behind. Now, I give you an example. If all Nigerians can maybe bring in about 200 naira, right, each month, now you are looking at about 200 million Nigerians. You know how much we're talking about. Now multiply that by a year. You see that we will be able to have billions, hundreds of billions of naira that we can pump into the health sector and provide healthcare services for all Nigerians. So that's just the key, to healthcare financing. Insurance, in the healthcare system is what will help us, to be able to achieve that muscle. Now, after the annual budget for 2021 was passed, my question was presented by the president. My question was, I haven't gone through the COVID-19 pandemic. What would have expected that Nigerian budget for health would have increased? In 2005, I think in 2005 or so, the Abuja Declaration stated categorically, all African countries came together and said, look, for us to be able to address our healthcare challenges, we should be able to earmark at least 15%, 15% of our annual budget to healthcare. I am telling you, from that year till today, Nigerian government has never even reached 10%. That's the situation. How do you expect our nurses, our doctors, our health workers to be taken care of? Every year you see thousands of Nigerian doctors going to UK, going to North America for greener pastures. What happens to us here?
Okay, so in curtailing this yellow fever outbreak now, the vaccine is quite free.
It's free. It's free.
In primary healthcare centers and some also other private hospitals now. Also, it looks like you mentioned, the demand side and the supply side.
Exactly.
Do we look inwards in providing for our people such that we bring to the barest minimum this yellow fever outbreak?
Now, like you said, yellow fever vaccine has been free, right? Now, what we should be doing now is we need to talk to our people. We need to encourage people to go and get themselves vaccinated. I'm also looking at, why don't we, I was discussing with a colleague yesterday, and I said that, look, The expanded program on immunization, EPI, for polio has worked. Now Nigeria is polio-free. Have we thought of probably utilizing the model that we used in fighting polio to fight some of these diseases that are still endemic in this country? Yellow fever is not an exception. We can be able to roll up immunization programs and ensure that we get everybody vaccinated. Between the age 9 months of age to 44 years of age, everyone needs to be covered with that vaccine. Now, one of the things that you observe is that when people only go for yellow fever vaccine, maybe when they want to travel, because they need the yellow card to travel.
Yes.
It should not be the case. We need to communicate the risk to people. This is what we call disease risk communication. Let people know that, look, yellow fever has a high mortality. In fact, in Nigeria, we have about 15 to 20%. In some places in Nigeria, we have up to about 50% mortality, meaning that 5 out of every 10 person that suffers yellow fever will die. If we tell people that, look, this disease is very, very lethal, it is very, very deadly, Nigerians will know and understand the need to go and have themselves vaccinated.
Thinking about it, a lot of people might not have gone for their yellow fever vaccination, but how often should one go?
The beautiful thing is that yellow fever vaccine, it needs only just one dose. In fact, that one dose will last you for a lifetime. You don't even need a booster dose. You know, against what people used to say that, okay, maybe after, 10 years. No. I'm telling you that you do not need a booster dose. Just get one, and that serves you for a lifetime. So everyone should see the need to just go get that one dose, and it's fine.
Okay, so how important is our educational institutions?
Well, I would say this, that you see, education is the bedrock of development across board, whether it's in the health sector, in the economic sector, everywhere. Now, you see, one of the challenges that we have in Nigeria is that educationally we have a lot of encumbrances, and these things play out in the way we practice healthcare in this country, I tell you. Now, you see, against what you find in other climes, where healthcare workers actually more like should I say counselors. These are people that when you get to them, you are already healed. You're already healed before you even access treatment. Unfortunately, when you go to some healthcare facilities in Nigeria, you find a nurse, you find a healthcare worker shouting on you. Yeah. And the truth is that, apart from the fact that the training has not been done in such a way that people should understand the need to be empathetic. Now you go to a hospital, but before you start talking, the doctor is already writing prescription. What happens to nutrition? What happens to immunization? We do not stress this aspect of healthcare that is also important, because our healthcare system believes that once you go to the hospital, you should take medication, and whether you are fine or not is nobody's business. So we need to rework our health, healthcare curriculum in our schools. Doctors, in fact, healthcare workers across the board should be more empathetic and should also think of non-pharmacological ways of tackling disease, especially in terms of disease control where vaccination, immunization comes in.
In 2019, at least, we brought this yellow fever issue to almost zero in Nigeria, but now it has gone this far. How important, or in a city like Lagos now, the hustle and bustle, how do you expect people to take out time to go get the vaccine?
You see, that is where innovation comes in, creativity comes in. Trinity Healthcare Foundation, my organization, rolled out a program sometime last year. We called it Mobile Vaccination Services. We understood that in cities like Lagos, Abuja, Port Harcourt, one of the challenge there is that people do not have the time. Even when people have the time, they cannot go and queue up. Sometimes it can be frustrating going to queue up just for a vaccine, and at the end of the day, you may go home without doing it. So what Trinity Healthcare Foundation actually did, we tested a model which actually worked, was that we open a web-based, a web-based platform where people can actually order their vaccines. For the ones that are free, we get those vaccines to them, and ensure that they can have those vaccines, particularly those that are staying very remote from healthcare centers. It is a model that we tried and it worked, and we intend that will, suggest to the government. How
will those in remote areas access this? Because the internet is a key part in all of this.
Yeah. Now, what we did was that the second aspect of that, that project was to deploy USSD code. You don't need an internet. With just your USSD, and it's free. You just dial a USSD code number, and then it links you to the nearest healthcare facility, and then you can have the people deployed to your community. Because there are some places where people just can't access health. That is the truth about it.
Okay, but in deploying that kind of technology now, state governors, what can be done? Because a lot of these outbreak is largely in remote areas where the primary healthcare centers are not fully equipped.
Exactly, exactly. Now, the thing is this, like I said, it is that it has come up to the time. We have seen the success that we have recorded with polio. Now, like I said, nothing stops us from incorporating what we, I mean, when health care workers go to administer polio vaccine, why not carry other vaccine along? Hepatitis vaccines. Right now, we are saying that we have over 24 million people living with hepatitis. Why? When we have a vaccine that can prevent it. Yellow fever has killed over 76 people. When we have a vaccine that can prevent it, we should be able to apply the expanded program on immunization just the same way we achieved, and it helped us eradicate polio. We should be able to apply that same principle, that same strategy with all other vaccine-preventable diseases, and I can assure you that we'll see to the end to it.
How do we do that when the health budget is not even at par?
That is where that is the issue right now. That is the issue right now. But I also feel that state government have a role to play, right? Whatever comes from the federal government should be more like a supplementation to what you have. All state government have budgets. They have health budget, they have economic budget, and all of that. State government needs to, like I said earlier, prioritize health care. They should be able to make sure that health workers are deployed to these remote village places. Primary healthcare centers must be strengthened. We must have, honestly, I would say that a project that I'm supervising currently, I realized that one of the things I realized when I went to one of the hospitals, one of the primary healthcare centers, you will not believe this. I went there, I saw just a single doctor.
That's the case.
Single doctor in a whole primary healthcare center. What do you expect the doctor to do? He's not a magician. He can only do what he can do within his capacity. I tell you that one of the reasons why you see healthcare workers being very apprehensive, I used to say, is because the burden is much. The burden is much. We need to make sure that we close some of these gaps so that we can be able to cater for the health needs of Nigerians. Healthcare funding is very key, and insurance, I would say, is very key, because even if we have the funding, if we do not have a very good insurance system like we have in even Rwanda here, even Kenya here, then we will not be able to ensure that health care is accessed by everyone without causing economic hardship to everyone.
All right, Dr. Kanembasi, thank you so much for talking to us.